I first dislocated my kneecap playing a soccer game when I was in the 7th grade. So that initial injury is kind of what started all of my knee problems, and from that point on I had a super unstable kneecap that was constantly dislocating when I would do just simple activities. I quit soccer, quit running, anything like that. I picked up swimming actually, and I did that through college and through high school. And then my junior year of high school, I had my first knee surgery, and that was to attempt to help stabilize my kneecap more. I did not address my cartilage issues at that time, and then once I recovered from that surgery, later that summer I actually jumped off of a rope swing at the lake and dislocated my kneecap right after I had recovered. At the time when he told me that I had cartilage damage, it was either the MACI procedure or a total knee replacement, and I was 23 years old, so a total knee replacement was not something that I wanted to do at that time in my life. It has impacted my life in so many ways. Living with knee cartilage damage for so long, I had learned to just live with the unstable kneecap that I had had for so long. Now I'm back to, confidently going on runs, participating in workout classes and things like that I had done before, but not confidently, and was always scared that I was gonna re-injure my knee, so. I was extremely impressed with the rehab portion of the MACI procedure. They lined out exactly what to expect week by week, and I had goals to strive for. If I knew at the time when I was 17 that MACI was going to exist and someday that I would have this surgery and that I could have a glimpse into my future and know that my knee cartilage damage would be repaired, it would have been a huge gift and relief to myself, knowing that there was an end to all my problems.
Indication: MACI, autologous cultured chondrocytes on porcine collagen membrane, is made up of your own autologous cells that are expanded and placed onto a film that is implanted into the area of the cartilage damage and absorbed back into your own tissue. MACI is used for the repair of symptomatic cartilage damage of the adult knee. The amount of MACI applied depends on the size of the cartilage damage. The MACI film is trimmed by your surgeon to match the size and shape of the damage to ensure the damaged area is completely covered. Limitations of use. It is not known whether MACI is effective in joints other than the knee. It is not known whether MACI is safe or effective in patients over the age of 55 years. Important safety information. MACI should not be used if you are allergic to antibiotics such as gentamicin or materials that come from cow, pig, or ox, have severe osteoarthritis of the knee, other severe inflammatory conditions, infections or inflammation in the bone joint and other surrounding tissue, or blood clotting conditions, have had knee surgery in the past 6 months, not including surgery for obtaining a cartilage biopsy or a surgical procedure to prepare your knee for a MACI implant, or cannot follow a doctor-prescribed rehabilitation program after your surgery. Consult your doctor if you have cancer in the area of the cartilage biopsy or implant, as the safety of MACI is not known in those cases. Conditions that existed before your surgery, including meniscus tears, joint or ligament instability, or alignment problems, should be evaluated and treated before or at the same time as the MACI implant. MACI is not recommended if you are pregnant. MACI has not been studied in patients younger than 18 or over 55 years of age. Common side effects include joint pain, tendinitis, back pain, joint swelling, and joint effusion. More serious side effects include joint pain, cartilage or meniscus injury, treatment failure, and osteoarthritis. For more information, please see full prescribing information at maci.com.